Hello and welcome to this VetLit podcast. My name is Simon Cook. I'm a criticalist here in the UK, and it's brilliant on this occasion to welcome Vicente Herreria Bustillo, a very good friend of mine and a resident mate of mine from when we did our ECC residencies together too long ago now. We'll maybe not reveal when, Vicente. But Vicente is head of ICU at the Catholic University of Valencia in Spain and was recently lecturing at IVECCS in San Diego on feline high-rise syndrome. Now, I went to his lecture, I very much enjoyed it, and I couldn't miss the opportunity to invite him to teach us about cats falling out of windows. Thank you for joining us, Vicente.
Thank you, Simon, and thank you very much for having me. It's an honor to be here. There are some very big names in the podcast, so yeah, I
No,
feel honored that you invited me.
the honor is all ours. I I'll be completely honest, and I'll start by saying that other than summarizing it on a kennel sheet quite well, I never really recognized or didn't used to recognize the value of considering high-rise syndrome as a syndrome. But there are some really cool components of the syndrome which Potente is going to teach us. But for me, one of the first things, like the light bulb moments or the take homes from your lecture at the very beginning, was that these are, to some extent anyway, predictable or avoidable. What would you say to that?
Yeah, yes, they are. Because looking at the publications on this topic, pretty much, especially with cats, there is a pattern of specifically age tends to be younger cats, the ones that jump or fall from these tall buildings, and it's typically when people start opening the windows. So in spring, definitely summer, beginning of autumn. So yeah, people could, like we as veterinarians could do more to prevent these issues by maybe communicating to the public. Like, listen, if you have a young cat, if you live in a tall building, maybe put a net, close your windows, do something to try to prevent this.
Yeah. Young cats, what one-ish between whatever months. It's like a seasonal disease,
Mhm.
essentially. I never really thought about it like that, but it
Yeah.
basically is. So then the other thing that I very much enjoyed, we can spend as long on this as well, I'd gladly spend the whole time on this, is the physics behind the fall. Can you tell us a bit more about the basic? Because this brings back memories for me of GCSE physics and the conversion of gravitational potential energy to kinetic energy. Hit me.
Yeah, that it's very important, and it's a very important feature why they survive these incidents. And that's because the force that the cat is going to exert on the ground, it largely depends on something called terminal velocity or terminal speed, which depends on the mass of the object that is falling. So if we compare a cat to either a person or a large dog, it's going to produce much less force when it hits the ground. So that's one of the things that makes them more likely to survive. And then another important characteristic of cats is their ability to fall on their feet, like the what is called the riding reflex. And so they are very well prepared to fall on their four extremities so they can lessen the impact against the floor.
Hmm. So then F equals ma. No?
Yeah, exactly.
That's where
So
I want to spend some time.
yeah, so the force that is going to exert on the ground depends on the acceleration that the cat has achieved times the mass. So because they are much lighter, then they are more likely to survive than if we fell from 6 stories or
Yeah. And it's the deceleration, isn't it? It's like the force that they will be exposed to when they hit the ground, if they hit it, as opposed to
Mhm.
managing to land it, uh, is equals or is proportional to their mass times the deceleration. So I just like thinking about that, right? In terms of
Uh-huh.
the way that the principle behind anything that breaks their fall, i.e., something they hit on the way down or a softened
Mhm.
landing, is just
Mhm.
that it decreases the rate of deceleration, doesn't it?
Yeah.
When they actually hit the. I just like thinking about that. I like a bit of physics. So then that writing mechanism stands them in good stead for lower falls. Is that right?
Yeah, so there is a paper published in JVEC, I think it was the year 2020, if I get it right, 2021, published by Lefman and Pretty, and they describe it pretty well and then theorized about the height of the fall. Um, they speak about that if the cat falls before reaching the terminal velocity, they are more likely to fall on their feet from the riding reflex and all, and you are more likely to see injuries on the extremities. Whereas if they fall from much higher up, higher than 5 stories or so, they tend to extend their legs after that, and they tend to hit the floor more with the belly or the chest. So you're more likely to see lesions on the chest and abdominal organs. And I think probably because it's from a much higher fall, even if they fell on their feet, it's going to be like too much force just to diminish it by falling on their feet. So
Yeah, yeah, yeah.
more likely to see lesions in the chest and abdomen.
So then does it actually seem to be the case that the the frequency of fractures, of limb fractures, do they tend to be quite high in the lower falls and actually missing in the higher falls then?
More than missing, like maybe you don't see so much thoracic and abdominal injuries.
Okay, yeah, yeah.
The ones that have fallen from maybe 2, 3 stories, very frequently they will have like fracture metacarpal bones or maybe a other forelimb fractures, but they do not tend to have like serious cavity damage. Whereas if they fall from much higher, they will do.
Fine. So it's yeah, so that writing is protective at lower, but still could well be present, as well as the thoracic and abdominal ones
Yeah,
later. Okay, I
yeah.
see.
The fractures are very very common with these.
What about the specific types of thoracic injuries and the specific types
Mhm.
of abdominal injuries? Because I had some revelationary moments during your talk on especially the abdominal ones anyway.
So basically, you could expect any type of injuries from the thorax, but probably one of them, the one that is described most frequently will be shock from either a tension pneumothorax causing obstructive shock or just from bleeding. And then I think that pulmonary contusions are definitely underrepresented because the cats that we see in the clinic, I would say probably more than 95% of them have B lines on ultrasound compatible with pulmonary contusions. But in the most of the studies, they are not heavily reported. I think that's because they were based on radiographs, and some of these lesions probably you can see them at least early on better with ultrasound. And it is also described to have heart trauma, which includes tricuspid valve rupture. There is one publication about this, and we definitely have seen one case, which was very interesting. But the prognosis is described as quite poor. Our cat didn't was put to sleep as well, and the other cat was diagnosed at necropsy. So,
That's crazy. That's essentially one, I don't know, 1 millimeter of mercury shy of just a complete cardiac rupture, presumably. I don't know the actual physics, but that's crazy just to think how close they came to a complete cardiac rupture and just instant
yeah,
death to just rupture an
yeah.
actual valve. That's insane.
Yeah, it's very cool because apparently it's the first valve that's gonna hit if a cat falls on his chest, the right ventricle is the one getting the most force. So it's much more likely that they're gonna rupture the tricuspid rather than any other valve.
Very cool. Reading around this topic recently, I found this study from last year talking about those cats in which a traumatic pneumomediastinum had been documented, and it seemed to be that many of those were as sequels of high-rise syndrome itself, and that's probably one of my favorite radiographic findings I love spotting a new mediastinum, no?
Yeah, definitely.
So then what about the abdominal injuries? What do we expect to see,
So
or are there any, what are the, I mean, there are some pretty cool injuries there.
yeah, definitely. I mean, you can see some of the classic ones that we tend to see with any other animal that has sustained abdominal trauma, like hemoabdomen, uroabdomen, stuff like that. But that definitely one of the cool ones is pancreatic trauma, which has been extensively described in cats with high-rise syndrome. In a study, they report up to 35% of cats having signs compatible with traumatic pancreatitis. And even there is a case report of 4 cats with pancreatic rupture, where the pancreas completely like fracturing in 2 or more pieces, and it carries a grave prognosis, at least from that publication, where only half of those cats survive to that.
Okay.
And it is apparently is I've never seen in any case a pancreatic rupture, but apparently it should be fairly easy to diagnose. Because if a cat that has fallen from a building, you see free fluid, take a sample and compare the abdominal lipase with the blood lipase, this will
Okay.
be much higher. Like in this paper, it's reported up to 22 times higher. Like only with 4 cats, we cannot have like a clear cutoff. But I would say if you have a significantly higher lipase in the maybe more than twice or more than 4 times, it will be highly likely to be a pancreatic rupture.
Yeah, amazing. I've definitely never had that, but with all the comparisons we do in
Yeah.
terms of creatinine and potassium
Mhm.
and glucose, etc., one to add to the, well, it's not a wish list, is it? But you know what I mean.
The list.
Yeah, the list. Yeah. I suppose the patient that you are monitoring post-trauma, it's very feasible that they, based on, we're saying, what, nearly a third, you say, or about a third might have
Yeah,
a trauma-induced pancreatitis.
yeah.
So if they are developing really painful abdomens in the following days, I mean, I
Yeah.
guess you might have to consider other differentials. Do they ever get gastrointestinal tract ruptures, or is that probably the most likely explanation for a cat to be developing post trauma and post stabilization abdominal discomfort, presumably?
Yeah, I don't think I've ever seen it or read it like a
No.
septic peritonitis derived from high-rise trauma. I think it'll probably be more likely that it's either, as we said, a traumatic pancreatitis or maybe spinal pain referred to the
Yeah.
abdomen. I think that could be
Yeah.
a big one. Or even if there's free fluid, maybe your abdomen or stuff like that.
Yeah. And the heme abdomens. Do you have a gauge? Do they
Mhm.
ever end up? Because we're saying that trauma-induced heme abdomens are non-surgical. They're very rarely surgical. Do you have the impression
Yeah.
that's the case in these two?
Yeah. Like very frequently, we will see a little bit of free fluid and anemia in the patient. But I don't remember any cat that we had to take to surgery due to traumatic hemoabdomen with high-rise syndrome. Normally, we do conservative treatment, antifibrinolytics, etc. And I think it tends to stop on its own.
Cool. Okay. That brings me on to a question that I wanted to ask you anyway.
Mhm.
Is you clearly have an interest in these cats, but you've also been working in that realm of antifibrinolytics and hyperfibrinolytic disorders. What's on your either recently completed study list or to-do list in this area? Because they're
Mhm.
quite a cool population of cats, right? If anything, or of patients at all, because if anything, they're kind of standardized, right? Compared to other types of trauma. Would you agree?
Yeah, yeah. The especially regarding their age, yeah, it's a quite homogeneous population. So we are gaining information now about acute traumatic coagulopathy in these cats, but our data mainly consists on just traditional clotting times. We don't have a lot of viscoelastic testing on these cats because it's quite frequent that they will fall either out of hours or during the weekend. So at our institution, we mainly can run tests during normal hours. So that's something that it would be cool to have that data, but we don't. Maybe we mainly we do clotting times
Yeah.
in all of them, but we don't have viscoelastic.
Yeah, yeah. Okay. Do you use a lot of tranexamic acid in these cats then? Are they quite a good population to be using it as a default? What do you think?
Yeah, like we tend to do it as a standard treatment for to all of them, really. Tend to pre-medicate them with maropitam to avoid any emesis, and then give them tranexamic acid. However, we are still lacking studies in cats about, like, how we have studies in dogs that have described that the antifibrinolytics have a dose-dependent effect on fibrinolysis. And we don't have that study in cats. So it's something that we do because we think it's likely to be effective, but still we need much more. So we need some prospective studies basically
Sure.
to confirm that this is effective and useful.
Conducted in city centre hospitals with
Yeah, it will be, yeah, it will be I mean, that's something that's been in my mind for a very long time. Doing, I even have a cool name for the study. Maybe one day will be released.
Are you allowed to reveal it?
No,
Oh no.
just in case
Okay.
he wants to steal it.
Yeah. No, no, that's fine. Yeah, yeah. Brilliant. Well, thank you very much. But is there anything that you that we haven't covered that you would have wished to cover, or any other future potentials that you'd like to achieve in this realm?
So there is an interesting study that we spoke about in the lecture because many of these cats present with pneumothorax, and quite frequently we have to place chest drains due to attention pneumothorax, and because these we mainly like probably most institutions nowadays we are doing the small bore chest drains with Seldinger technique, and these chest drains appear to have a moderately high risk of complications, like the old chest drains as well, or
Yeah,
hopefully a little bit less. But in a study from 2022, they reported like approximately 30% of these drains had complications either from causing an pneumothorax or even lung perforation. In 2024, in BMC Vet Research came up a study where the authors did a cadaveric study evaluating different recumbency positions to avoid complications. And from the results, it looks like that for pneumothorax, we probably should be doing a lateral recumbency. So we make sure that the air is going to go to the side of the chest, and then we are inserting the first cannula in there, avoiding the lung. And then for pleural effusion, placing them in sternal recumbency, and again placing the first cannula and the wire where the fluid is
actually
to
is.
avoid puncturing the lung.
Yeah. Cool. Yeah. I mean, I don't know whether maybe this is more off record, but we definitely have the impression that the larger bore catheters, because they come in a range, right? And we
Uh-huh.
definitely feel like we see more complications in the bigger bore rather
Mhm.
than the ones that we're used to, and maybe actually arguably we should be saying, like everything else in veterinary, right? Do as much as you need to, but as little as possible, and actually using just a smaller bore might be a sensible approach. That's certainly what we're defaulting to. I don't know if you have the same impression or not.
Yeah, I think that's very sensible. Yeah.
Yeah. Okay. Well, Vicente, I can't thank you enough for joining me. It's such a pleasure to host you.
Thank you very
And
much.
no, not at all. And I'll make sure that any studies that we mentioned are in the notes. And for now, I'll just say that the aim of VetLit is to make veterinary literature both more accessible and accessed, and hopefully we've secured that in some small way today. Remember, you'll almost definitely find an article to read that interests you on the vetlit.org site. You can check back here, there, or via the email updates for more. And otherwise, have a great day. It's goodbye from Vicente.
Thank you, everyone. Thank you for listening, and thank you, Simon, for having me.
Not at all. And it's goodbye from me. Bye for now.